All right, so this is the last section of our outline fetal circulation. Let's talk about the fetus. So when a baby or a fetus is in the mother's womb, the mother is providing oxygen as well as nutrients for the baby, and then the baby has to get rid of its waste products through the mother's bloodstream. So the organ that does that is the placenta. So let's just take a quick close-up look at the placenta. So the placenta is half fetal tissue and half maternal tissue. And the blood, right, there's an artery and a vein that travel to the placenta, and then those blood vessels will become capillaries, and the capillaries stay inside of the baby's portion of the placenta. And the mother's blood supply stays inside the mother's part of the placenta, so that the baby's white blood cells and the mom's white blood cells, or blood cells in general, they don't touch each other, they don't mix. So this is really important, because if the mother's blood and the baby were different blood types, the mother could destroy the baby's blood. But it doesn't happen because their blood never sees each other, because the placenta keeps the cells away from each other, but creates an environment where you can have diffusion take place across those very small capillary walls, okay? So the baby will come, the blood that is oxygen poor, that is full with waste, will come to the placenta. All the waste products will diffuse out. The mom's blood will pick up the baby's waste. The mom's blood is rich in oxygen and nutrients, and the oxygen and nutrients will diffuse away from the mom's blood and into the baby's blood. So there's diffusion taking place in the placenta. The blood cells themselves do not touch each other. They don't mix. They're not together. Okay, so they're separated, but there's diffusion taking place against the wall. So that's the job of the placenta. So let's go back to our picture here and look at our umbilical vein. So let's look at our letter A, the umbilical system. So we have umbilical arteries and umbilical veins. So let's remember our definition of artery. Arteries carry blood away from the heart. So the blood vessels, now think about this, is the baby going to carry oxygen-rich blood and nutrient-rich blood away from the baby towards the placenta, or is the blood going away from the baby's heart going to be oxygen poor and full of waste? And so you should answer oxygen poor and full of waste. The blood that's leaving the baby's heart, that's coming away, coming into the umbilical cord, right? That's going to be called an umbilical artery. It's coming away, but it's going to be blue, right? So here we go. The umbilical arteries are going to be carrying oxygen poor blood as well as full of waste. It's going to travel through the umbilical cord to the placenta, exchange away the waste, get oxygen and nutrients, and the blood vessel traveling back to will be called an umbilical vein, because it's moving towards the baby's heart. Okay, so remember, veins move towards the heart. So in this case, the artery and the vein are flipped with sort of the general circulation way of thinking about things. So keep that in mind. Okay, the vein is bringing bright red blood towards the baby. Now, in our bodies, where does our food go? Or, I mean, the blood from our digestive tract goes where? We just talked about this, the portal system. It goes to the liver. So same thing here, okay? So the red nutrient-rich blood coming into the baby's body through the umbilical cord first goes to the liver, all right? The liver is supposed to process that food, and then it goes in general circulation. However, the baby's liver is not fully functional yet, right? It's still developing. So it's not going to be able to process all the food coming in, and the blood coming in is a lot larger in volume than the liver can handle. So there is a shunt, an extra little blood vessel coming away from that liver called the ductus venosus. Okay, so you want to know this. This is special in the fetus, the ductus venosus. Now, I usually ask the class, is this dangerous that the baby's liver can't process the nutrients coming from the mom? And sometimes I get, a lot of yes, like it doesn't seem like that's a good thing, right? That the baby's liver is not working, but actually it's fine because the mother's body has already done the filtering for the baby. So the mother's digestive tract filtered into her liver. After her liver, it goes into general circulation, at which point it can go into the placenta, right, and then feed her baby. So it's fine. The ductus venosus will put the blood into general circulation. Okay, so that's the umbilical system, right? Umbilical arteries, umbilical veins. So I talked about all these things. After you give birth, you cut the umbilical cord. The umbilical vessels in the baby constricts and degenerates into fibrous bands called ligaments, and the umbilical arteries become umbilical ligaments. All right, now let's look at letter B, which is around the heart. So the baby is obviously not breathing on its own, so the lungs are not functioning, and the lungs are still developing, so they do need blood, right? And they need oxygen themselves, but the amount of blood coming in to the heart is not necessary to go to the lungs. So we're going to divert blood away from the pulmonary circuit. And so what I want you guys to do is look here in this fetal heart circulation. Okay, so I made a larger image of this heart, and let's look at this blood. So the color purple is used here because it's an intermediate oxygen content. You see that the red blood coming from the mother is mixing with the blue inferior vena cava blood of the baby, so we get purple. That's why it's purple. So if we want to avoid the lungs, we come into the right side of the heart, right? So deoxygenated blood comes from the right atrium from the inferior side and from the superior side. So here we are at the right atrium. You guys know that the blood will be pumped into the right ventricle, and the right ventricle pumps it to the lungs. So the right side of the heart is going to go to the lungs. Now, the first feature you want to know about, number one, is the foramen ovale, which is right here. There's a hole in the right atrium, the wall between the right atrium and the left atrium, so that the blood coming into the right atrium just pops right over to the left side, right? If blood moves to the left side, now it's going to get pumped to the body. It avoided the lungs altogether. So this is one of those structures only in the infant, or sorry, only in the fetus, right, when the baby's in utero, to divert blood away from the lungs. The second area is that we're going to pump that blood into the right ventricle. The right ventricle is going to pump the blood into the pulmonary trunk, and now we're on our ways to the lungs. However, there's another little shunting mechanism here. So there's an extra little blood vessel here, and this is called your ductus arteriosus. Okay, it connects the pulmonary trunk to the aorta, and that will divert the blood away from your lungs as well, because it's on the way to the lungs, but then some of it's going to pop right into the aorta and then enter general circulation. All right, so your lungs do get blood. Blood does reach your lungs enough for the lungs to develop, but the lungs aren't oxygenating that blood. They're not doing anything, so they don't need all the blood to go there. So there's two mechanisms to divert blood away from the lungs. Okay, again, the foramen ovale and this ductus arteriosus. Now, after the baby's born, this is the interesting thing, right? Circulation normalizes immediately with that baby's first breath. So what happens is the baby takes a breath, the lungs inflate, and there is this huge pressure change that happens within the lung and the heart. And so that pressure change is going to shut a flap that exists behind the foramen ovale here, and it closes this foramen ovale off, right? So then the blood no longer goes to the left side, it goes into the right ventricle. And then I looked this up. It's pretty complicated, but I think there's some oxygen content shift, pressure shift as well, that the smooth muscle here contracts, and it basically pinches off this route. So then with the baby's first breath, blood flow is normalized, right? You have a normal blood flow through the baby's heart. Pretty amazing. It takes time for these structures to sort of completely seal. So if you look at the structures in the adult heart, what happens here is that there's a little fossa. In fact, if you watch the heart dissection where it was the human heart dissection, she does point out the the fossa ovalis in that right atrium. So there's a depression here called the fossa ovalis. And then this guy right here becomes a ligamentum arteriosum. So it becomes a little ligament, the ligamentum arteriosum, which I always think sounds like a Harry Potter spell, ligamentum arteriosum. All right, so it takes about it takes time. I mentioned the time. It's not important for you to know that, for them to completely fuse. But those are the remnants of fetal circulation. All right, so here we have those features, right? The fossa ovalis closed, so this would be the foramen ovalis closed, so that would be the fossa ovalis, and then here's our ligamentum arteriosum, which was the remnant of the ductus arteriosus. And then last question for you, true or false? The umbilical artery carries blood that is relatively low in oxygen concentration. So think about it. The umbilical artery goes away from the baby. This is a true statement. The blood going away from the baby is bringing all the waste. So the mom's body can take care of it. All right, and that's it.